The importance of learning good squat technique cannot be overstated, but because everyone is different in terms of their anatomy, their strength, and their available joint mobility, everyone's squat will be different, and there is no singular way that humans naturally squat. Now in this video, I'm going to discuss some of the key things that we should keep in mind as we squat so that we can maximize our joint health long term. We're starting with your stance width. Now, the stance width that we choose is related to our available mobility in our joints, mostly the ankles and hips. If I use a really wide stance, I suddenly need a lot more hip internal rotation to effectively squat in this position. Versus if I use a much more narrow stance, now I'm more dependent on ankle mobility as well as hip flexion mobility. Most people are going to fall somewhere in the middle of these two. But the thing to keep in mind is you want to find a position that feels natural and not constrained and tight. Forcing yourself into a stance width that doesn't necessarily correlate with your available joint mobility long-term has the potential to cause some problems. When we're doing a squat, our feet are the foundation of the movement. Having a stable foot through the squatting motion is what's going to allow you to effectively and efficiently move heavy weights. I want you to think of your foot as a tripod. One point is on the heel, one point is the base of the big toe, and then one point is the base of the pinky toe. You need to maintain contact with all 3 points during the entire motion, and then you want to minimize motion of the foot and ankle itself as you're going through the squat. If we see a lot of motion at the foot, this is going to translate to problems up into the knees. Many people don't realize this, but the knee is not simply a one-dimensional joint. It doesn't just bend and straighten. As you squat and when you're descending, your tibia needs to move internally a little bit relative to the femur. Now, what this should look like in practice is your kneecap should aim towards your mid to outer foot when you're doing the squat. For most people, that is a good enough cue and it should feel somewhat natural. Sometimes people can have a little bit of tibial torsion, meaning their lower leg is a little twisted in or out, and this changes the angle of the foot. Look at where your kneecap is relative to your foot when your leg is straight. As you descend into the squat, your kneecap should now be tilted outward based on where it was before. If it doesn't do that, we are causing a lot of unnecessary stress on the knee itself. When it comes to how deep you should squat, you've probably heard that your thighs need to be at least parallel with the ground. Now, depending on your available joint mobility, you may or may not be able to do that safely. If you have a restriction and you can't get to that position, you need to borrow mobility from a different joint, and what this does is it places a lot more stress on that other joint. The depth of your squat should be relative to how much available mobility you have. Don't try and squat deeper than you can safely, because this is going to shift forces in a way that has the potential to cause problems long term. How far forward your torso leans when you're squatting is largely dependent on your anatomy. Someone who has a much longer femur, when they squat, their weight will naturally shift backwards. In order to stay balanced, they have to lean their trunk forward, otherwise they're going to fall on their butt. Now, the important thing to consider here is you need to keep a neutral spine and a stable spine through the motion. If you lean so far forward that you lose that neutral spine position, now you are at risk of placing more stress on the back and potential injuries. Going along with that, we need to make sure that we are bracing our core effectively, especially when moving a heavy weight. Now, we have muscles that surround our entire midsection, all of which are important for bracing. We're not simply squeezing the abs, we're trying to brace the core in 360 degrees. And what this does is it helps to stabilize the low back and minimize unwanted motion there. We don't want to overbrace because then we can't breathe and we can't move effectively, but we want to make sure we have enough of a brace that we're assisting the back in stability. When we're squatting, we want our head and neck to stay neutral relative to your back. What this means is as I go down, my head relative to the back should not move. If I look up or down, people tend to move the back as well, which we don't want. Again, we want to maintain a neutral spine, not extended and not flexed. Something that everybody should be able to do is work on their timing when they squat. What this means is as you ascend, your hips and your knees should straighten together. We shouldn't see a delay in one or the other. Now, this is dependent on how much weight you're trying to move in a lot of cases. If you do see a problem here, then decrease the weight and then work on your consistency with each repetition to properly coordinate those two movements. If you found this helpful, then go ahead and follow along for more. In the next video, I'm going to talk about some of the more common mobility-based deficits and compensations we will see with those, as well as how we can go ahead and try and fix that.